on a very pertinent topic, cancer of the cervix and its prevention. Before introducing our guests and panelists for the evening, let me share with you some data. Cancer of cervix is a global health concern that affects the lives of countless women around the world. In India alone, cancer of cervix is the third most common cancer with an incidence rate of 18.3% and the second leading cause of death with a mortality rate of 9.1%. India accounts for the highest number of cervical cancer cases in Asia. The research also revealed that out of 40% of the total deaths from cervical cancer, 23% occurred in India. These are some extremely frightful statistics, but this very frightening picture comes with another important fact, that this cancer is the only cancer which has a preventive vaccine, provided it is taken on time. Now, this is where INAYAT, the Interact Club of Birla Vidya Niketan, comes in. We, in collaboration with RCDS, that is Rotary Club of Delhi South, our parent club, are undertaking a project to provide vaccines to our girls at a lower cost than available in the market, which can prevent cervical cancer. We do understand, however, that you might be a little reluctant and have some inhibitions regarding the same. Hence, we have a panel of medical professionals and Rotarians with us who, through this session, will delve deep into the details of the vaccine and clarify our doubts regarding the same. You may also type in your questions, and I'm sure they will be addressed towards the end. So now let me introduce you to all our guests. We have with us Dr. Ashima Gulia. She's a PTA body member of the school. Dr. Ashima is a senior consultant gynecologist and laparoscopy surgeon currently practicing at Cloud9 Hospital. She holds an array of degrees, MBBS, MD, DNB, MNAMS, and FMAS. We welcome you, ma'am.
Thank you so much for the warm welcome.
We couldn't have, Dr. Abhishek Gulia, her husband was also supposed to join, but he's busy in some emergency, so he will be joining us a bit late. We also welcome Dr. Vanita Kapoor, who is currently working in Fortis La Femme. Ma'am is a radiologist with over 30 years of experience in medicine and healthcare. She has worked with both corporate and charitable hospitals. Her primary focus has been women's health with a special focus on pregnancy, infertility, cervical cancer, and breast cancer. She is also an active Rotarian. Glad to have you with us, ma'am.
My pleasure entirely.
We also have with us Ms. Vandana Bhalla, who is currently the presently the Assistant Governor of Rotary Interact District 3011. She's a committed social worker who has worked for over 15 years in this field and has led several Rotary initiatives for her club. She's actively working with the Rotary Cancer Foundation and leading the initiative for cervical cancer awareness and prevention in the district. We welcome you, ma'am.
Thank you so much.
And of course, we have with us Mr. Naman Agarwal. He's a man wearing many hats. He's an alumnus, a parent, a founding member, and a past president of the Interact Club of Birla Vidya Niketan. He's currently the director of New Generation Services at the Rotary Club of Birla Vidya Niketan. A CA by profession, he is currently a senior partner at Ernst & Young. He has been very active in the area of social and community welfare, and he works very closely with our interactors in the school. Welcome, Naman, sir.
Thank you, ma'am. Thank you so much.
I would now request Principal Ma'am to kindly speak a few words.
Namaskar. And first of all, my apologies for being late. I was coming from Rohini and the traffic was mad on the way. And it took me 2.5 hours reaching here. So the delay. And first of all, Naman, we are so proud of you. We are so proud of you and grateful to you. Like, you know, a son looks after the parents, or the daughter looks after the parents. It's like you are looking after BVN. We are so proud of you. And the parents and the other doctors, thank you so much for having found time to be with us and teach us some very fine things about cervical cancer, which, as Shipra said just now, is such a deadly disease. But the good news is that it is preventable. And with all your efforts, I'm sure the girls, I wish And I pray that they stay safe always. And if I'm not wrong, Shipra, this vaccine helps boys also in some way?
Yes,
Oh.
ma'am, that's what we are going to clarify now today.
Yes.
We are all a little
Yes.
confused about that, but definitely we'll
Yes.
clarify.
So thank you so much. With all your support and keen interest, I'm sure our children will have a better life. They'll stay healthier, and God bless all of them. So Shipra, over to you. I think you can start.
So I'm going to begin with Dr. Ashima, and Dr. Ashima, you might laugh at my question, but let me tell you, it's a very pertinent question, because whenever we talk about cervical cancer, the mind goes to the
cervix.
spine rather than the cervix.
Yeah.
Could you please clarify for our audience in very, very simple terms what actually cervical cancer is all about and how is it contracted?
Yeah. So thank you for giving me this opportunity to spread awareness about cervical cancer and its prevention, and to speak about the vaccine. So coming to your question, yes, many people confuse cervical cancer with the cervical spine problems. But when we talk about cervical cancer, it is about the cancer of the lower part of your womb. So the uterus is a balloon-like structure. It tapers down into a narrow, longer structure, the lower part of which is called as cervix. Cervix is like the door to your uterus, like it's the opening of your uterus. It opens into the vaginal cavity. So any cancer developing in that part of the uterus is called as cervical cancer. Okay. So
and
yeah.
That's quite well explained, I think. And how does one contract this kind of cancer? How does one get it?
Yeah, so cancer in itself is development of abnormal cells over a period of time. So if there are changes happening in the cells of your cervix over a prolonged period of time, and this process of conversion of normal cells to abnormal cells is called as dysplasia. And if these abnormal cells remain for a longer period of time in your cervix, if they're not removed or they are not destroyed, they can turn into cancer cells. So what brings in this changes in the normal cells? Why should a normal cell convert into an abnormal cell and then convert into a cancer cell? So the most important cause for this change is a virus which is called as HPV virus, that is human papilloma virus. And this virus is transmitted most commonly by sexual contact. And you'll be surprised to know this is the most commonly contacted infection. It is the most commonly sexually transmitted infection. Almost everybody who is sexually active would have had this infection once in their lifetime without even knowing about it. So HPV is the virus which is the cause for this cancer. So this virus brings in changes in the cervical cells, and over a period of time, say 10 years, these cells change into abnormal cells, and after a certain point of time, these abnormal cells convert into cancer cells. And once those cells change to cancer cells, there is no stopping. It grows very fast, they multiply very fast, and it spreads to other parts of your body also. Yeah.
So what I understand is probably that the HPV virus would infect everybody, mostly everybody, but whether it changes into a cancer or not, that is depending on
yes,
how it multiplies.
Because this virus is not a single virus. It's a huge family of viruses. There are almost around more than 100 strains. And to identify them, we have numbered those viruses like HPV 1, 2, 3, 4 and all. And out of those 150 strains, there is a classification of these viruses. We have classified these viruses into high-risk viruses and low-risk viruses. So high-risk viruses are those which would cause these cancer changes, these cellular changes in your body. So most commonly, these are the 16 and 18 types. And that doesn't mean low-risk viruses are okay. Low-risk virus also causes problem in you, but they may not cause cancer. They may cause genital warts and other problems. Okay. Yeah.
So, Dr. Vanita, I'd like to ask you, so what, to my understanding, that if this cancer is contracted because of sexual activity, so the age group is what it would be around starting from 18 to 25, 30 somewhere.
Not really, because these days sexual activity starts
So
earlier.
that's why I wanted to ask you is that parents might ask this question that
No,
my child is very young, why should I get this vaccine for my child?
Actually, we don't know when sexual activity starts. And as we know, the world is changing and evolving very fast. Even when we know it's our girls, we can't believe that sexual activity has started, number one. Number two, we also find that the first dose, if given soon after the girl has her periods, is the best time to vaccinate your girl. So if she's 13 or 14 and you've given your first dose at that point of time, in a large number of cases, you don't even require the second dose. But usually 2 doses are required. If I give it later in life, and a lot of people say, I'm 30 years old, should I take it now? The efficacy goes on decreasing with age. So ideally, the time that we give the dose should be between, say, after the girl starts menstruating, up to the first dose, up to the age of 26, really. But you can expand it up to the age of 40 as well. And some say 45, but I would say really 40. So actually, it's important to give it early. I think Dr. Ashima would agree with me.
Yes, I definitely agree with you. And also I would like to, mention that although this virus is most commonly transmitted through sexual contact, but it can also be, contacted by non-sexual activities such as skin-to-skin contact, deep kissing, and oral sexual activities also. So we don't know how early children might start, and it is always good to de-link sex from this vaccination and don't look at it from that perspective, and take it as a protective, preventive measure against this deadly disease. We are not saying that your child may contact it through sex, so give it before she has sex. It can be really contacted from a deep skin-to-skin contact also, if she comes in contact with a person who is carrying a HPV. And we don't know what kind of HPV virus the other person is carrying. The person may be carrying a high-risk HPV virus or a low-risk HPV virus. So when we have this armor with us, why not use it and protect our children?
And what is the, Vanita ma'am, Dr. Vanita said that the efficacy depends on as early as you get the vaccine.
Yes,
that's what
yes.
we
The vaccine is proven to be most efficacious when it is given before the first sexual encounter. But that doesn't mean people who have had sex or married people shouldn't get it. Even people who are married and above 26 up till 45 can go for this vaccine, because at any point of time in your life you might have HPV virus, but not necessarily you might have got the high-risk virus. You may get it in future also. So to prevent that future HPV virus infection, it's better to take the HPV vaccine.
I have a question here. May I, Shipra?
Yeah, ma'am, of course.
So, Dr. Vanita, you said that if someone takes this vaccine once, generally there is no requirement of the second one.
See,
How do we come to know?
No,
that
I'll
there
tell
is
you,
yes.
there is some research now which says that you can get away with 1 dose. Some research from All India Institute. But by and large, you require 2 doses if given on time. By and large, that is still the norm that we are following, the 2-dose norm. So,
all right, thank you. Yeah.
So, Dr. Vanita, like ma'am started with this question, the HPV virus. So the males can also contract this virus, I believe. Can the males also contract this virus, the HPV virus?
Yes. And that is why the government of India also thinks it's important first to roll out for the females and then roll it out for the males as well. Yeah. And I think Dr. Ashima will elaborate the 2 reasons why the male should also get the vaccine. I mean, yes. Am I right, Ashima?
I'd be more than happy to explain about this. So this virus loves the epithelial cells. It is epitheliotrophic. So it attacks the epithelial cells of both men and women equally. It doesn't discriminate gender-wise. And we are talking about cervical cancers. That is because females have the cervix, and cervical cancer happens to women. But in men, this virus can cause anal cancers, penile cancers, oral cancers, oropharyngeal cancers. So it's very important that our boys also get this vaccine.
Okay, that's news to me, at least, because actually I didn't know about this. So thank you for
Even
enlightening.
the low risk viruses can cause genital warts in boys also.
Okay.
Yeah.
So tell me, is this also genetic by any chance? No.
No, this is not genetic.
It's not a genetic.
Transmitted from one
Infection.
person to other, skin to skin or sexual contact.
Yeah.
All right. How does this, if any one of you, either Dr. Vanita or Dr. Ashima, could answer, how does this vaccine actually work?
So,
Ma'am,
ma'am, would you like?
Go ahead, Ashma. Go ahead.
So this vaccine that we give is not the virus itself. It's a virus-like particle. It's a protein that appears as a virus to the body. When we give this vaccine, the body mounts an immune response for this vaccine, and it starts producing antibodies. So with the second dose, with the third dose, the efficacy of this immune system increases, and your body remembers this virus and produces antibodies and protects against this virus.
Okay.
So it's a virus-like particle. It's not the actual virus. So people need not be afraid of this vaccine also.
Yeah.
Yeah.
So that is what we want to, sort of tell the parents, that there's nothing to worry about. So added to that question, Dr. Vanita, if we...
Actually, I think earlier people were very worried about the side effects.
Yeah.
So
exactly.
first and foremost, it's given as a subcutaneous thing. Preferably, it's usually given in the deltoid, and the patient should be lying down or something, not just go on injecting the patient and tell them run away. So in a rare incidence, you may have some nausea, or you may have some vomiting, or there may be some flushing, but the incidence of side effects is very, very low. I mean, we really don't see the side effects when you're vaccinating the child. And initially, there were a couple of vaccines which were started, and then they were withdrawn from the market because there were side effects. Today, none of the vaccines in the market have this kind of side effect. So they are absolutely safe, nearly painless, and that's about all. But it should be given in a controlled environment. You can't just tell them, okay, it's an uncontrolled environment.
I'd like to say something to this.
Yeah, ma'am.
So far, I have had 4 cervical cancer vaccination camps in Delhi, and these have been in 4 different schools. And we have vaccinated about 250 children so far. And up till now, I haven't even seen one girl having some adverse kind of a reaction. Maximum we've seen is there is some soreness or some redness. And even after that, after they've had their vaccination done, we make them sit around for about 15 minutes in a special room or something, give them a fruity or a cold drink and, some snacks to eat and all, observe them for about at least half an hour, and then let them go with their parents. But up till now, no reactions or adverse reactions at all.
I think we are all used to the COVID vaccine of waiting and, getting ourselves, when we feel okay, then we are on the move. So I think that's a good thing. So Vandana ma'am, one more question that I would like to ask you is could you please tell us what vaccines is the foundation going to provide our students?
Okay, so Rotary Cancer Foundation has come up with this very, very novel program that they are, going across to different schools and spreading awareness all around, and then asking, after giving a talk to the parents, convincing them, answering all their questions, dispelling all their fears, then taking approval from them, like we have a consent form, and which takes in all the information of the child. We also have an indemnity bond for them to sign, so that tomorrow there is no, if the child does have some kind of an adverse effect, maybe due to some other reason, maybe she's come in having fever, or maybe there is some other problem with the child, at least Rotary is not going to be blamed, the school is not going to be blamed, the doctors or the hospital that the doctors are coming in from, the nurses are coming, those are not going to be blamed. So there are two vaccines that we're dealing with through the Rotary Foundation. One is Gardasil, and the other one is the Indian vaccine, which has been taken up by Serum India, which has been produced by Serum India, the very ones that had done COVID vaccines. So this is called Sarvavac. So we have these two vaccines that we deal with, and we leave it up to our clubs to decide which one they want to, administer.
Okay. And when you're at it, could you also tell us a little bit about the pricing? Because the parents would like to know about that also.
Yes. Pricing, if they go to the market, the MRP is going to be around 3,300 and something, 90 something, or 3,500, you can say, for the Gardasil one. That is one vaccine. But if you turn around and look at our Sarvavac, this costs us, we brought it is for about 2,000 rupees in the market, the MRP, but we've been able to, bring down the prices. So it works out to 1,260 rupees per vaccine for us.
Okay.
I'd also like to add that supposing a vaccine is, say, 3,000 rupees, the Rotary Cancer Foundation funds 50%.
This is not in all the cases.
Mm-hmm.
Supposing we are going to a school where there are a lot of EWS children, or we're going across to another school also where there are, the category of EWS kids are there. To them, we do fund 50%. But if the families are affluent, they'll happily pay, I'm certain. They can pay us, or they can, we are just trying to spread awareness right now. They can also take the child to a doctor, or their own doctor, physician, or maybe to a hospital or whatever, get it done. But yes, Rotary Cancer Foundation does give 50% to the children for the vaccine.
Okay, that's good. So what I understand now is that if we first we need to give out some forms to the parents.
Yes.
To fill in. So Naman sir will help me here. Naman sir, how would this work with us?
So ma'am, firstly, I'm Naman.
Okay, Naman.
As an ex-student, I cannot be called sir over here.
Yeah, all right. Taken. Fair enough.
So ma'am, I think the way Rotary Foundation, the Rotary Club will work with you is, firstly, we need to decide whether we want to go for Sarvavac or for Gardasil. I think we've got two doctors here. They can give the pros and cons of both. I think it's like a choice between, during COVID times, you've seen the choice between Covishield and Covaxin. So likewise, there are different vaccines that are available, and we will try and get a 50% subsidy on this for you. So that, and we'll come back with to you. So we'll get you a form which will say that this is awareness. Now it's really up to the parents whether they want to get a vaccine at the first place or not, because that's really the parents' call. If yes, then they've got multiple options. They may want to go to their own family doctor, their own pediatrician, their own gynecologist. That's their choice. We can then, if the school's okay with it, we can do a camp at the school and have a choice of vaccines. Now, this is not between the parents and the school to decide which one they want to go for, and we can have that arranged. We'll have doctors and paramedics that will be there. We'll have refreshments arranged, and we can do that in a very controlled environment, because it's a question of girls, and at times there are questions of privacy. We have curtains, or we have separate rooms where the immunization will happen, and then there'll be separate waiting rooms. So that we'll have to work out with the school as to how the facility will be there, but there'll be complete privacy when the vaccines are being administered for obvious reasons. And there will be doctors who will be there to administer that.
So,
Okay.
Naman, actually, it is very similar to when we were giving the Covishield or the Covaxin, because after you got the person, you made them sit for those 15, 20
Yes.
minutes, right? It is a very similar thing.
Similar
So
process.
just trying to bring out the simile to parents. We've all been through that. It's a very similar thing. You're made to sit for a little while, and then you have something to drink there, and then you go. Exactly the same sort of protocol. And it's not as if you're collapsing with it.
Mhm.
And as Vandanaji also mentioned, she's done 4 camps, and we've done camps in some of the remote areas of Delhi. It's not only the affluent schools that we're talking about. I've been personally involved in a camp in a not so privileged area of Delhi, where we did this camp for girls from the underprivileged section of society, where the vaccines were administered. Dr. Vanita was there. Not a single case of any untoward incident that happened. The girls were sitting in a room before the vaccine. They were administered the vaccine. They were given some refreshments for that 20 minutes waiting period. And then they very easily walked off. Some redness and all soreness that happens with any immunization. Anyone can have it. Someone may have a fever for a day, but that's pretty normal. So we could actually do it on a Friday. Fridays work best because then there's a weekend. So if someone's bothered about missing school, even that's taken care of, because then there's easily 2 days to recuperate. If someone has a sore hand or has some slight fever, that may happen, but that's pretty normal in any vaccine.
And also,
I'd also like to say one thing more is that in Balwant Rai school, as well as the DAV school of Vikaspuri, we, specially spoke to the parents of special needs children and children with special needs. And they got convinced, of course, and they brought their children there. So it was a very good thing, because these children are most vulnerable. They can't really protect themselves. So it's very important for us to vaccinate these children also. And a few children of these we found in Balwant Rai, and a few of them we found in, Vikaspuri TAV school. So that was a very good thing.
That's a fantastic point, Vandana. That's, I think, very enlightening for everybody to understand that, you have these children, and I think most children in most schools now, there's an inclusive policy, and it's an excellent point. I just wanted to say that for some reason, it's not necessary to force your child if the child is running fever. So your child is running fever and you say, oh, today is vaccination day, jana hi padega. So I think that should also be brought out. Your child is sick. For any vaccine already, if your immunity is down and I'm going to pump in something else, obviously the vaccine is going to be blamed rather than anything else. So I just wanted to point that out as well.
That's very right, because where we are concerned, we take about 12 members of from the hospital come along with us. And this is doctors, nurses, paramedics, and junior staff as such. And we take along a fully equipped ambulance also, in case there is some kind of an untoward incident that takes place. So our doctor first checks out the child. If the child is having any problems, like in Balwant Rai, we did find a little girl having fever, but the mother was insisting, nahi, free mein hai, lagwao, So the doctor said, nothing doing. Next time aap aa sakte hain isko leke. And next time we are going there. On the 23rd, we are having a camp over there, and that child is going to be brought in and then vaccinated. So we make certain that the child has no problems and is perfectly healthy. And that is how we go in for the vaccination.
And also one more, since we are at the fever part of it, if the girl is on her period, are they okay? I mean, is it okay for the vaccine to be taken during that time? Yeah, that's...
Yes. Absolutely, it's fine. If any girl or any woman is menstruating, it's absolutely okay for her to take the vaccine. There is no such contraindication with respect to menstrual cycles.
So basic contradiction is only during pregnancy given, but I mean, we are not talking of that population.
Right. And also, I would also like to ask either Vandana ma'am, that is there a number to it, or do we need to restrict it to a number, or I mean, how we can have.
You will have to talk to the Rotary Club. Like
Okay.
I think in your club, it is
I can take
Rotary
that.
South. Yes,
Yeah,
please.
yeah, that's
I'll
fine.
take that question, Shubhra, ma'am. So
Yes,
the answer is no, there is no restriction. What we do is we'll first seek the consent form from the parents and through the school. And once we have a fair write-up, because we need to arrange for the vaccine. So we need some ballpark indication as to how many vaccines we need to bring in, but there is no upper cap.
we definitely want the parents to get to have that consent form and the indemnity bond to be signed before only. And then we take the number from there after they've signed it. They can't come on that day and say, ye raha.
Thoda about, let's see, because that's largely to get the vaccines, because these vaccines have to be kept in a cold environment. They cannot be kept outside. So we get additional vaccine and there are no takers and the vials go bad.
It is also because Naman, the children are too young to give their own consent for anything, right?
That is definitely not.
Parents' consent is there.
Parents'
So the
consent.
parents' consent has to be there, as Vandanaji was saying.
So what, like in one of the camps where we did it previously, the parents came on the D-Day saying that, okay, we'll sign it off right up. Now, if we have spare vaccines, we can accommodate that. But if we don't have the vials with us, then obviously those who signed up before get priority. Otherwise, it'll be unfair on them.
Definitely.
Achha, and one more important question, which I missed earlier. Suppose, as you say, that there are two vaccines, there are two doses that are available that you have to take. What if by chance a student skips this, forgets about the second vaccine, or, doesn't take it on time? How does she have to take it again, the first vaccine, or, both the doses are given again, or she can take it later also?
So the guidelines say that even if you have missed any subsequent vaccine, pick it up from where you have left. Suppose you have taken a vaccine first dose today, the second vaccine is supposed to be given between 1 or 2 months. And you've forgotten, you've traveled, or you've moved out of the country or state, for whatever reasons, if the second dose has been forgotten, pick it up from there itself and consider that particular day which you are taking the vaccine as the second dose day and continue from there onwards. So 3 doses are very important, to create a proper immune response in the body. The dosing schedule is 2 is the 2-month duration where you get the second vaccine, and 6 is after 6 months of the second dose, that is a booster dose. So you need not worry and you need not start over again. You can pick it up from where you left.
Yes, Naman, I think you wanted to say something.
Yeah. And this is where Interact comes into play and Rotary comes into play. So while the medical aspect has been explained by the doctors, what we're also doing is when we do these camps, we have a list of those girls who've taken the first vaccine. And when we're doing the second camp, we can obviously tick off those who've taken the second vaccine. Now, if someone is ill, someone is traveling, or for some XYZ reasons, they've missed it, taking the vaccine at the camp, we do a follow-up with the parents. That's where we can come in just to ensure that either they've taken it elsewhere from their own doctors, or they come back and so we actually, it's a polite reminder to the parents that please get this done so that you haven't missed it. So if you may have missed it at the camp, but you can obviously do it, and that could be for a variety of reasons. Someone may just fall sick that day, someone may be traveling, or someone may just forget. So that's where our Interact can play a very active role.
I think also the system of reminders, like you've had this on so-and-so date, Interact can bring in that thing that your reminder is coming up for your next vaccine and something like that. They always work, reminders always work.
And I think that since the children are ours, it's easy for us to give them a general reminder that next week, this day, camp is being set up again, and please get your second dose done.
One thing more I'd like to say is that we've got our entire paperwork done. Like we have the consent form with us, we have the indemnity bond. We also have an Excel sheet, created where all the numbers of the children are there, the names are there, the entire data of them is there. And also, if they've had their first dose done, we tick mark over there. And whenever they get their second dose, if they get it, don't get it or whatever, then the second dose tick mark is there also, because we have to get this done from the school and pass it on to Rotary also, so that we can also tally with our Rotary International and give it to them also the information that this is how many kids we've done in India.
Right.
And I have one question. You said that there are two types of vaccines, two companies. So at one point of time, is the vaccine of one type only provided or choice-based?
I think Naman can take
Yeah.
that question.
So, ma'am, the question, if I get your question correctly, is whether at the camp, whether we'll have both vaccines or we'll have either one. Ideally, the preference is to have only one, and that is for that we'll decide in consultation with the school, and the school can decide in consultation with their parents. Getting both can just create a bit of a havoc. So we avoid doing that at a camp. Either we bring Servavac or we bring Gardasil, either of the two, whichever the school has a preference for, and the school can decide. That'll be an ideal situation. And if your question was the second vaccine, and this is more for Dr. Vanita and Dr. Ashima to answer, but the ideal situation is if the first vaccine was Gardasil, the second one will also be a Gardasil, and likewise for Servavac. So we don't mix up, like first for Servavac and second you go for Gardasil. That's not advice.
Yeah, absolutely.
Yeah, absolutely. If you have taken your Cervarix vaccine, we do not recommend to shift to Gardasil. It's better to follow what you have taken earlier.
Yes.
Yeah, so that's about it. Any questions, Mriganka, that you would like to ask?
Good evening. I was wondering whether parents would accompany the children while the vaccine is going to be administered, or would the children on their own be able to take the vaccine and go back home in the afternoon?
That's really for the school to decide. It could be either ways.
It is better because, the fear factor is there in the child. So if the parent is there, the mother is there, the father is there, they kind of come and they cajole the child, hold the child or whatever, and it's easy for them to get the vaccine. Otherwise, any injection is scary maybe for us also.
Yeah, like today I went to the classes to just, remind them that there's a session. So this one girl stands up saying, ma'am, I have phobia of needles. So I can imagine, how scared they would be at their age. She was just in 7th standard, I think. So
this is concerned, I want to tell you exactly how we administer it. It is not the regular needle that we use. It's the microfine thin needle that we use. And, I'll tell you one incident that I always relate to people, that in Nai Disha, the NGO that Naman was talking about, there was this young girl who came, oh, mere ko dard hogi. And she came and she held herself like this and she shut her eyes. I was standing there, the mother was holding on to her and the nurse was there, vaccinating her. So she said, dard hogi. So nurse, stopped and she says, kya hai? So she says, lagao na. She says, laga to diya, ab jao na, ab dusri ko aane do. Because it is so fine, the needle, that it's almost painless.
Like an insulin needle, really.
So that's good. That's good to hear. So Naman, one question to you, that your daughter is studying with us and she's at that age where she's eligible for the vaccine. What are your views? Please share.
As a parent, it's a no-brainer. The vaccine, I'm going to get her vaccinated, that's for sure. See, looking at the statistics, it's a very scary statistics, not only because it's rising, it's largely because the social fabric and the behaviors is changing, and we have to accept that. Gone are those days when you had single partners. But you have to accept that. While we may say, hamare ghar mein nahi hota, but then you can't be sure all the time. So you have to accept the reality of the society, and it's better we do it sooner than it's late. So as a parent, better safe than sorry.
Yeah. Naman, I have a question. We have teachers also. Unmarried. And I mean, I really don't know that whether they are sexually active or not. But in case they wish to have this vaccine, does the scheme apply to them as well, or they pay full and get themselves vaccinated?
Ma'am, on the scheme, it will apply to them as well. On the efficacy and on whether they can, that is for the doctors to answer. But yes, they can take benefit of this.
So any woman, any person for that matter, age 9 to 45 can get this vaccine, and definitely it is efficacious and prevents against cervical cancers. And giving the vaccine before the first sexual encounter is not a mandatory thing now. As I said, even married women can get this vaccine till the age of 45 years.
Okay.
So how we are doing it in Rotary is that from 9 to 20, we are giving the vaccine. And after 20, we are, if they are getting it done or whatever, they have to go in for 3 vaccines. This is the way it's to be handled.
Yeah, exactly. Because after that, automatically your, your immunity, when you're young, you'll develop the immunity very fast. So the 2 doses are really very good. No?
So that
I'd like to tell you something about Rotary. Rotary International has taken up this cause extremely seriously. Rotary International for the world, that this year they have granted $2 million to Egypt for just cervical cancer, right? And whatever grants we're asking for, from Rotary International, I think they would be cleared very easily for us. Like there is a certain person who is closely connected to them, and he's promised, I'm district chair for cervical cancer for Rotary. So he's promised the governor and all of us, he's going to get in 1 crore for it, so because it's a very expensive vaccine and there are millions of people that need to get it done. I want to also tell you about the statistics. Every minute, there is one person in the world who is being detected for cervical cancer. Every 2 minutes, there is one person who is dying of cervical cancer. And in India, it is 8 minutes. So you can imagine how the spread is and how painful and deadly this disease is, that we have to protect our little ones from it.
And also one more question that I had, that once you've taken this vaccine, the detection happens through pap smear, I believe. That is the test that we take. So do the girls or whoever takes this vaccine, they need to get their pap smear done again? No, that.
Once you took the vaccine, that doesn't mean it's the end of it. The screening should continue. The cellular changes take a long time to develop. So we have to keep ourselves screened continuously. And girls who got their vaccination would begin their first screening at the age of 21 years. The screening begins from 21 years of age. So there are 2 methods of screening. One is pap smear testing alone, and the other is co-testing, which is pap smear plus high-risk HPV DNA testing. Okay, this is called as co-testing. So if you're doing pap smear testing alone, it has to be done once in 3 years. And if you're doing the co-testing, you have to get it done once in 5 years. Getting the vaccine doesn't guarantee you, you can skip the screening or you can stay relaxed. Screening should continue. Pap smear is a test where we collect the cells of the cervix and study under the microscope so that we can pick up any changes happening in the cells at the earliest. Yeah.
Okay, thank you. I think we've covered most of the questions. So yeah, Naman, sorry.
Yeah. So, ma'am, I just took a cue from what the principal ma'am offered for teachers. While I haven't spoken to my club, but I'm making an offer over here. If you want to have the DDs of the school vaccinated who are in the age or their children, we will offer 100% discount. We'll give it free of cost. Right? And I'm sure Vinita ji will support me in the board on that.
That's wonderful. That would be lovely.
And Shukla ma'am, I forgot. I just want to add one more thing. Even if a girl is sexually active, she need not get the testing before the pap smear test before 21 years of age. Pap smear screening starts only after 21 years of age, but vaccination should be given as early as possible.
Yeah, thank you. So I think we've done with the questions, but I would still request all of you to give a last remark for the parent who's still a little reluctant probably in the audience. So we'll start with Dr. Vanita.
Yeah, I'll go first. I always talk about this at any awareness program. It sounds very stupid, but I think when we're talking about gender equality today, the most important thing is that the woman never treats herself as priority in a family. It goes through all strata of society. I say that एक औरत अगर उसका हस्बैंड शराबी है या उसका हस्बैंड मर जाता है, वो कपड़े भी धोएगी, वो कपड़े सिएगी, पर वो अपने बच्चों को पाल लेगी. If there's another man in her life, she'll think 3 times about it because she'll say कि भी मेरे बच्चों का क्या होगा. And abhi bhi, the same does not apply to the man. So she is the spine of the family. She is the spine, and therefore every woman should be respected. And we need to look after our girls. We definitely need to look after our girls, because one educated, vaccinated woman will educate 5 more and look after 25. So I always say this in every time.
Thank you. Dr. Ashima?
Yeah. So, in today's era where we are, the incidences of cancer is rising and rising and rising. It was not like this many years ago. Nowadays, cancer doctors are more busier than the gynecologists. So such is the, incidence of cancer. So this is one vaccine which can prevent you from getting that deadly disease. So I would urge every parent to get their children vaccinated, and do not think that my daughter is still not sexually active or not married, or why should I give this vaccine to my boy? Irrespective of the gender, irrespective of the marital status, irrespective of the sexual orientation or status, please get your children vaccinated, and you would be doing them a favor, protecting them from this deadly disease. And once you get cancer, it's really bad. It's devastating. So only cancer which can be prevented is this, with a vaccine.
Yeah, very true, very true. Vandana ma'am, sorry.
Yes, I think they've said it all, both of them, Ashima as well as Vinita ji. And but all I tell the parents, like, I don't, get a very fancy class always to talk to over here. Of course, I have the educated lot that I'm speaking to today. I'm honored about it. But usually we try going across to, a little lower standard schools, and I have to talk to the parents. And I have to blackmail them, literally. I also use strong words like, you have to do it, nahi to, it's like a sin not giving your child this vaccination. And it's coming to you free of cost. It's coming to your doorstep, and we're making you aware of it. What more can you ask for? The best doctors, nurses, I get them over from BLK hospital. They're all very kind people. They're just offering it to us free of cost. And it's coming to their doorstep. And I think it really needs to be done, because otherwise, it's devastating. The same little child, if she's not given this vaccine and at older age she gets something like this, it'll finish the family, and it's so painful. It's so painful that she'd rather get death than stay on carrying on with it.
Absolutely right. Right. Now,
I request all parents to think about it twice, thrice, whatever, but get it done.
yes, ma'am. Yes, ma'am.
Shipra, may I?
Yeah, ma'am.
Yeah, since I deal with children, and I would only urge children and their parents, एक पिज्जा कम खाओ, पर ये vaccine ले लो, and stay healthy, because cancer is a very deadly disease. It just doesn't kill only, but it devastates the others who are left behind.
Entire family.
So just one pizza less is not a big deal. And thanks to Rotary for offering this facility at the doorstep means a lot to us.
Yes, ma'am. True. एक पिज्जा कम खाओ, ये वैक्सीन जरूर लगाओ. हम ये वाला स्लोगन शुरू कर देते हैं. Yes, Naman, your words words of wisdom for the parents.
As a parent, all I'll say, tell all my fellow parents over here is, see, this is really, we get so many vaccines done for our children. While this is not a mandatory vaccine, when our kids were young, we were giving them polio drops, we were giving them MMRs. All of us took COVID vaccines just as a prevention. Now, if there is something which is available, while the government has not mandated it as yet, but this is available, and I'm sure all of you have taken pneumococcal vaccines and all, which were optional vaccines, just for your own child's safety. They're still your children, so why shy away from this? And here you're getting it, the cost, even if we were not offering the 50% discount, it really doesn't matter, because it is एक पिज्जा नहीं, 2 पिज्जा कम खा लेना, उतना ही तो फर्क पड़ने वाला है. That's about it. But it nothing at the cost of health, which can be really devastating, and it can really be very, very painful for those who've contacted it. So let's not even think about it. And this is the only form of cancer there's a preventive vaccine. No other cancer has a preventive vaccine which has been discovered till date. So what is available, let's grab it with both hands. That's all I'm going to say.
Yes, absolutely correct. Thank you so much. Ma'am, Principal Ma'am, would you like to say something to the parents?
I always said that एक पिज्जा कम खाओ, एक पिज्जा कम खिलाओ, पर vaccine जरूर लगाओ. Grab the opportunity or the wonders of science, the medical science, or whatever we call it, but grab the opportunity. Don't let it go. It's important. Our children's health is something most important to us.
Right. So once again,
And for any question, in case they have, they may contact us even later. And I'm sure Naman and his team will be available to help us with those queries.
Okay.
Thank you once again to all of our panelists. It was a very, very enlightening session. And I really, really hope that we've been able to convince the parents who've been listening on to us. And soon, let's do this noble work. Let's take it ahead. Thanks to Rotary, we'll be doing one more noble job for the society and for our school.